Methodist Hospital of Southern California presents a Medical Minute on heart valve replacement with Dr. Eli Capouya.
The purpose of the heart valve is to keep the blood flowing through the heart in a certain direction, in a forward flow or antegrade flow. And heart valves can either leak or they can become stenotic or stiff and not open and close properly. Traditionally, for aortic stenosis or aortic regurgitation, which is a leaky valve, we have to open the chest, put the patient on the heart-lung bypass machine, stop the heart, open the aorta, take the old valve out, put a new valve in. A new type procedure has been developed where we can replace an aortic valve without having to open the chest. It's called transcatheter aortic valve replacement, or TAVR. With that kind of procedure, a valve can actually be loaded onto a catheter, and obviously that procedure is much less invasive, and patients can potentially go home within 1 to 2 days after the procedure. Even the older patients with a lot of different medical problems can be in and out of the hospital in 2 or 3 days, and I've seen some go home the day after surgery.